We have over 20 sponsors for this year's Quality Talks event. One of our newest is Scene Health. Our next guest started out as a lawyer in England before launching his first company in Munich over 20 years ago. Sebastian Seiguer is the CEO and co-founder of Scene Health, formerly known as eMocha. Scene Health deals with improving medication management. They combine telehealth methods with clinical coaching, developing new methods of patient intervention. Sebastian, welcome to Quality Talks.
Thank you for having me.
So if you would, tell us what medication non-adherence is. And I think you use that term very specifically as opposed to non-compliance, right?
Yes, compliance is probably a word used mostly in clinical trials. So non-adherence refers to patients not taking medication as prescribed. So on an actual day, was medication taken properly? Was the technique, administration correct? And are they taking it over a period of time consistently? So that's very different than the quality metrics that we're talking about today. The adherence quality metrics are really a proxy. That's really a refill measure.
So it's very clear, based on some of the talks that we've heard through today, that the compliance is actually relatively poor. What are the costs to the healthcare system as a result of this?
Look, when people don't take their medication properly, they end up in the hospital. It's very simple. This has been documented over decades. The cost of non-adherence to the entire healthcare system is well over $500 billion a year. That's even more than we spend on medications themselves. But it's also very obvious. Medication regimens are more and more complex. People are leaving the hospital and spending less and less time in front of clinicians. They're confused. Medications are complicated, so it's not a surprise that people are ending up with issues with their medication and ending up in the hospital.
So I've got to say, as a clinician, that's got to, for me, very frustrating. You know, you prescribe, it's not happening. So how do you go about using science and metrics to improve on this?
Right. Well, in terms of science. You're very right. So the physician's orders, our job at Scene Health is to enforce those orders. Enforcement's really the wrong word here, but fact of the matter is, over the last decades, there's only been one method documented, when we're talking about science, in peer-reviewed literature that shows a measurable increase in medication adherence. And that is a process called directly observed therapy. So every dose of medication in the inpatient setting, no exceptions, every patient, all conditions, they're all observed. Your therapeutic effect is measured, understood. Outpatient setting, it all falls apart. So in terms of using science, we lean on the model of care directly observed therapy. We enhance it with video and ensure the same result that happens inpatient, that gold standard of adherence, we're bringing it to the outpatient setting.
So as I think about this isn't just the patient. I mean, this is a community affair with family members getting involved. For those that are suddenly finding themselves in the caregiver situation, how do you shift the responsibility from the patient to themselves to the caregiver?
Well, you can't entirely shift the responsibility here entirely to the caregiver, because the patient has some accountability here as well. But the fact of the matter is that the regimens can be very, very complicated, and it would be totally normal to have a great deal of confusion around medication. What a caregiver can do is help eliminate that confusion. Make sure that questions that come up are answered by the provider. So a caregiver can play a really big role in helping navigate what is, in this country, an extremely complex healthcare system, and allowing the patient to have clarity as to what exactly they should be doing. And if they don't understand that as a caregiver, get the answer to the question.
So in the closing seconds, what would you advise for organizations that are thinking about this, for physicians? How do they sort of enable this to get the best results?
Well, I think that for physicians and for practitioners in our healthcare system, they're very overwhelmed. And I don't think that having them do one more thing is the answer to the question here. I really think that from the health plan side of things, where health plans are accountable for the care they're delivering, for the costs, health plans can move to a measurement of adherence based on whether people actually took medication and not whether it landed in their mailbox, right? So take accountability for whether people actually take medication properly.
I think that's a great point to finish on. Sebastian, thanks for joining me today.
Thank you so much for having me. Take care.